Thank you. Please be seated. We'll go back on the record in the matter of State of Utah versus MacNeill. He is present with his counsel. The state's attorneys are present. Have you had an opportunity to speak with your witness?
Yes, Your Honor.
Is she prepared to testify? Very good. Let's have her in. You may. Thank you. Please be seated. We're back on the record in the matter of State of Utah versus Martin MacNeill. He is present with his counsel. The state's attorneys are present. The jury is seated. Ms. Walthall has been sworn and has taken the witness stand. You may examine her.
Mrs. Walthall, will you state your name, please?
Anna Walthall,
Thank you. Will you spell it?
ANNAWALTHALL,
Thank you. What city do you live in?
Texarkana, Arkansas.
All right. And back in 2004, 2005, where did you live?
I lived in Park City,
Okay, Park City, Utah?
Utah.
Did you know Martin MacNeill back then?
I did.
Will you describe how you met?
I had a laser hair removal clinic here in Salt Lake, and he was my medical director.
Okay. What was going on with your laser hair removal clinic at that time?
Well, I opened it in late 2004, I believe,
Okay.
and it did not do well, so I closed it in probably October of 2005.
All right. What else was going on in your life at this time that you were interacting with Dr. MacNeill?
I was going through a divorce.
Okay. And was this an amicable separation, or how would you describe the divorce?
No, it was terrible.
Okay. So did your relationship with Dr. MacNeill move anywhere beyond professional relationship as an employee of yours?
It did.
Will you describe how that happened?
He knew my ex-husband and was helping my ex-husband with the stress of going through a divorce.
Sustained. Let's
Okay. Let's talk about you and Martin. How did your relationship develop over time?
He volunteered to be a liaison between my ex and me, and so we had more of a personal relationship because of that. He knew where my ex was, and then he ended up volunteering to help me with communicating and working out the divorce decree, and I eventually...
It's non-responsive
No.
and irrelevant.
sustained. It's a narrative answer. Let's
Okay.
proceed.
As Dr. MacNeill took on some more, I guess, personal roles in your life, did your relationship become something more than
Yes, I became
Employer-employee.
personally involved with him.
personally involved? Okay.
Yes.
Did that relationship ever become sexual?
Yes, it did.
Okay. Is it fair to say that you and Dr. MacNeill began an affair?
Yes.
Okay. Roughly when did that begin?
March of 2005.
Okay. And about when did it end?
I moved away from Salt Lake in October of 2005, so I may have seen him once after that, and we may have talked on the phone, but basically,
By that point, it's ending?
yes,
If not ended, it's on its way out?
right.
Okay. Did you and Martin have intimate conversations during this affair?
We did.
Did these conversations include deep subjects like religion, death, life ambitions, things like that?
Yes.
When did the conversations like that usually occur?
Pillow talk.
Okay. Okay. Just to make sure we have a clear record, will you describe what you mean by pillow talk?
Objection, Your Honor, relevancy.
She may answer. Overruled.
After you have sex and you're just laying there and you feel close and you talk a little more openly.
Sure. I know what it means. I just want to make sure anybody reading the record would know what it means. I'm going to actually ask you to zero in on one conversation specifically. Did Martin ever describe to you a process of making someone have a heart attack?
Yes.
Will you tell us what he said to you about that subject?
That,
But I'm sorry, let me pull back. Do you recall where you were when this conversation took place?
at my house,
In Park City?
yes.
Okay. Do you recall about when this would have happened?
I can guess, but I can't recall.
Okay. Fair to say it's sometime within that March to October time
Yes.
period? Can you narrow it down to any?
Probably
More than
closer
that?
to October.
Okay. Okay, now specifically about what he said about inducing a heart attack, what did he tell you?
There's something you can give someone that's natural, that's there after they have a heart attack, so that it's not detectable after they have a heart attack.
Okay, so you can give someone some sort of substance that's
Yes.
naturally occurring in the body, and it would be there after the heart attack, but it would also start a heart attack.
Yes,
And so you could cause someone to have a heart attack, and the drug would supposed to be there anyway, and so you wouldn't be able to tell.
that's correct.
Okay. Will you just give us a summary about how your affair with Martin ended? You mentioned you moved in October of 2005.
Yes,
Is that, did you discuss with Martin his maybe moving with you?
yes, we talked about it, and it was, he didn't make a commitment to do that. I just knew it was a possibility.
Okay. But he never committed to you saying, yes, I'm going to leave Michelle and come with you?
No.
How did you feel about that at the time?
The whole,
Objection, Your Honor. I don't think that her feelings are relevant.
Sustained.
Your Honor, I think it speaks to her motivation, potential bias for being present and testifying.
At this point, her motive hasn't been impeached.
Okay.
Sustained.
I have no other questions.
Thank you.
I'm sorry, can I have 1 minute, Your Honor?
You may. Anything further?
Yes, please, Your Honor.
Go ahead.
This conversation about the heart attack and starting a heart attack, did Martin ever say anything to you about whether that would be able to kill somebody?
I don't recall.
Okay. That's all I have.
Thank you. You may cross.
Good morning.
Morning.
You've talked with the investigators a lot in this case, haven't you?
Yes,
And you've shared dreams that you have had about the case, correct?
yes,
And you shared dreams of things that you thought were of evidentiary value.
possibly.
For example, you sent an email to investigators saying that you had a dream and you want to tell you, the investigators, that there is evidence from a computer which will clarify exactly what happened to Michelle.
I did write that.
Yeah, about a dream you had, right?
Yes,
And you sent another dream or another email to them saying that you had another dream, and you're wondering about the autopsy. Does it say anything about Michelle's toes? Correct?
I did write that.
Yeah, and then another dream about, is there anything in the mix about a white Toyota?
I did write that.
And you've been diagnosed with dissociative identity disorder, correct?
I have.
What used to be called multiple personality disorder?
Possibly. If it was inaccurately called that.
Okay. And you've also written in emails to the investigators that you want him, referring to Mr. MacNeill, you want him convicted for killing Michelle, right? That's what you said.
Probably.
And you also wrote in an email to them that you're really excited about the prospect of Martin being off the streets for a very long time, right?
Probably.
You testified at the preliminary hearing about this discussion that Mr. Perkins asked you about in relation to some chemical that could possibly start a heart attack, right?
Yes.
At the preliminary hearing, you said that you don't remember when that conversation would have occurred, correct?
That's correct. Same thing I said today.
Okay. That's all the questions I have.
Thank you. Any redirect?
Yes, please, Your Honor. Mr. Spencer asked you about dreams that you related to investigators. Do you think the content of dreams should be used as evidence?
Never.
What was your purpose for writing about that to the investigators?
You know, I was processing, and sometimes I just give too much information.
Sure. Okay, did you think it might lead them to evidence?
Maybe.
Trying to be helpful?
Yeah.
Okay. Do you know whether any of these dreams produced any evidence?
No. I have no idea.
Okay. Did you dream about Martin saying that he knew how to induce a heart attack in a way that was undetected? That testimony that you gave earlier, was that a dream?
No.
Okay. Did your dreams affect your testimony at all?
No.
Dissociative identity disorder and multiple personality. You said that that's an inaccurate characterization or an inaccurate name for it.
Yes.
Have you been diagnosed with anything like multiple personality disorder?
I have been diagnosed with dissociative identity disorder.
Okay, can you briefly tell us how that's different from multiple personality or what's commonly understood to be multiple personality?
Multiple personality is an old diagnosis that was an inaccurate diagnosis, so inaccurate, and it's not reflective of the condition that they were trying to name.
They've gotten rid of it.
So they just got rid of it.
Okay. Will you, do you work now?
Not currently.
Okay. Have you worked in the past?
Yes.
Besides the Sonic Clinic, have you run other businesses?
Yes.
What type of education do you have?
I have 2 bachelor's degrees.
What are they in?
One's in business and one's in music.
Okay. Have you raised a family?
Yes.
Are you currently raising a family?
Yes.
How does your diagnosis affect all of those things? If it does.
I'm sure that it does, but it doesn't render me unable to function. I mean, maybe I think something's funny when it's not, or, you know, it affects every day, but it doesn't determine whether I have a relatively normal life.
Okay. Does it affect your ability to perceive the difference between reality and fantasy?
Does not affect my ability.
What about truth and falsehood?
No, I know truth and falsehood.
Okay. What you've said about the conversation you had with Martin about the heart attack, is that the truth?
Yes.
Thank you.
Any recross?
No, nothing further.
Any questions, ladies and gentlemen, for this witness? May she be released? You'll be... Any objection from the defense to releasing her from a trial subpoena?
No, Your Honor.
You'll be released from your trial subpoena, which means you won't be called back here. You may step down. Thank you. Next witness.
State calls Alexis MacNeill, or excuse me, Alexis Summers.
Ms. Summers, if you'll come forward here to the clerk's desk, please. Raise your right hand and take an oath.
You do solemnly swear that the testimony you shall give in the case now and in the truth will be the truth, the whole truth, and nothing but the truth, so help you God.
Thank you. If you'll be seated here, please.
Good morning.
Morning.
Will you please give us your name?
Alexis Michelle Summers,
And Alexis, how do you spell your last name?
SOMERS.
Were you formerly known as Alexis MacNeill?
Yes.
Okay. When did the name change occur?
I legally changed my name, I believe it was in 2010.
Okay. Are you employed, Alexis?
I am.
How are you employed?
I work at Intermountain Healthcare Clinic.
And what is your position?
I'm
What is your- Go ahead.
I'm a family medicine physician.
So you're a Dr. Summers,
Yes.
in effect, okay. Can you talk about, so you practice medicine, and what is your position there? What is your daily routine there?
Well, I'm currently on maternity leave, but normally I see it's an outpatient clinic, so I see patients all day long in clinic.
Okay, and how long have you been there?
I just finished my residency in August, and they let me stay on for a couple months until my twins were born. So I've officially been a doctor out of residency for about 4 months.
About 4 months, okay. I'm going to take you back a little bit more with respect to your schooling,
Okay,
okay? Do you have an undergraduate degree,
I do.
and what is that?
I have an undergraduate degree from Brigham Young University in history.
Okay, and do you recall when you graduated?
I graduated in 2003.
Okay, and what about postgraduate school?
Yeah, I did a master's degree in the history of medicine at Imperial College in London.
Do you remember when you graduated from that college?
I got my degree in 2005.
Okay, and then you went to medical school.
Yeah, I
Where
started.
did you go to medical school?
Touro University in Henderson, Nevada. I started the fall of 2006.
Okay. What is your relationship to Michelle MacNeill?
She's my mother.
Okay. And your relationship to Martin MacNeill?
He's my father.
And is he in the court today?
He is.
Where is he seated?
He's seated to your left.
Is it to my right?
Or to your right, sorry, my left.
Is he wearing a blue tie?
He is.
Thank you. Can you describe your relationship with your father growing up, what that was like?
I had a very close relationship with my father. I kind of tagged along with him a lot at work. Kind of went into medicine because of my father. He was someone who I loved and respected and relied on, and someone who I always wanted to be proud of me.
Okay. I'm going to be asking you, Alexis, several questions about events that occurred years ago
Okay.
surrounding your mother's death.
Mm-hmm.
Do you have a memory of that time period?
I do.
Okay. Is it a perfect memory?
It's almost been 7 years, so not 100% perfect, but
Okay. Let's start off with April 11th, 2007. Do you recall that day?
I do.
Okay. And what's significant about that day?
That's the day my mother died.
Okay. Do you recall where you were when you first heard of your mother's death?
Yeah.
Tell us about that.
I was in a neurology lecture. I just finished up a neurology lecture at my school in Henderson, Nevada, when I found out.
Okay. How did you find out?
I called home,
Okay.
and my dad answered the phone and said, "Your mother's in the tub and she's not breathing," and hung up the phone.
What did you do?
I screamed. I dropped my bags and just ran to get in my car to drive to the airport
Okay.
to fly home.
Do you recall about what time of day this was?
It was morning,
Morning?
late morning.
Okay. Now, Henderson, Nevada, is that Pacific time zone?
It is.
So it would be an hour delayed from, or an hour behind the mountain time zone of Utah?
Yes.
Okay. So if it's
An
noon...
hour earlier.
Okay, an hour earlier, that's what I meant.
Yeah.
So if it's 12 noon here, it's 11 a.m. there.
That's correct.
Okay. You said you dropped everything and ran to the airport. Did you get a flight to Utah?
I did.
Okay, tell us what happened. Describe that day a little bit, like what happened next.
After I got to the airport or flew home.
Either one.
Well, initially when I talked with my father and he said, "Your mother's not breathing," and I dropped my things and ran. I didn't know at that time that she was dead, but I did call back several times.
Okay.
I believe the home phone, my father's cell phone. At some point, someone answered the phone, or my father, I think, answered the phone, but someone else picked up and was talking to me, and I was just screaming, saying, "Is she okay? Is she okay?" And
Did this individual say something to you?
Yeah.
Report to you? What did he say?
he said that it doesn't look good. She doesn't look good, and to come home. So then I continued to drive to the airport, and I was continuing to make phone calls, just trying to figure out what my mom's status was. When I got to the airport, that's when I did get the official the official call saying that my mom had died.
Do you know who made that call to you? Or who you talked to?
I called the hospital. I knew she was being transported to the American Fork Hospital. And I called the emergency room, and I believe it was my brother Damien that was there that told me she's dead.
Okay. So did you eventually get a flight
I did.
and you returned?
Yes,
Upon returning to Utah, did you fly into Salt Lake?
I did. I
What
phoned.
did you do next?
A neighbor or an old neighbor friend, Chris Anderson, picked me up from the airport and drove me right to the house in Pleasant Grove.
Okay. I'm going to stop you there and then take you back. This was the date of April 11th, 2007, correct?
That's correct.
When your mom died. And you were in Henderson, Nevada.
Mm-hmm.
And Henderson's a suburb of Las Vegas?
Yeah, it's about 15 minutes outside of Las Vegas.
Okay. Had you previously been in Utah in the previous days leading up to your mother's death?
Yeah, I had just flown back on the night of the 10th to Las Vegas. I'd been in Utah for a little over a week.
Okay. At this time in your life, you were in school?
Yes,
Okay. Were you in medical school?
I was.
And where were you in the process of medical school?
I was finishing up my first year of medical school. I believe I had about six weeks left before I had my summer break.
Okay. When you were in Utah in the days before your mom's death, was that a vacation from school or was that a break from school? What were the circumstances?
It was the school did have a spring. I believe it was a spring break during that week, but I went up specifically for another reason.
What was the purpose that so there was a reason you came home during that spring break?
Yes.
Okay, and what was the purpose?
My mom was getting a facelift.
Okay. And do you recall when you returned home, approximately the date during that spring break?
When I returned home,
Yeah.
back to Nevada.
When you returned,
Oh.
when
When I flew up to Utah.
to be present for the face.
Okay, yeah. It was around the beginning of April.
Okay.
I don't know the specific date,
Okay.
but it was before her surgery.
Okay. Let's talk just a little bit about that. Now, we talked about the home. Where is the family home that we're talking about?
This is 3058 North Mill Creek Road in Pleasant Grove, Utah.
Okay. And at that time, who was living in the home?
At that time, my mother and father, and then my four little sisters, Elle, Sabrina, Giselle, and Ada.
Okay. So you return home for spring break.
Mm-hmm.
And first off, let me ask you, when did you first find out about your mom's plastic surgery, that she was going to have surgery?
Just a couple of days before the actual surgery.
Okay. And do you recall how you found out?
Yeah, I got a phone call from my mom.
Okay. So you were informed of that. Did you interact with your mom and your dad in the days leading up to the surgery?
Yes, I did.
Okay. Did you attend any preoperative meetings with the surgeon that would perform the surgery?
I did.
Okay, let's talk about that. Okay. Do you recall approximately what that date was in relationship to the surgery?
I believe it was April 2nd, so the day before my mom's surgery.
Okay, so surgery took place April 3rd.
Mm-hmm.
And what did you do on that day?
I drove with my parents to the consultation.
And where was this consultation at?
I believe the consultation was in Draper.
Okay.
Mm-hmm.
And do you recall the physician's name, the
Yeah,
surgeon's name?
Dr. Scott Thompson.
Okay. So you were driving with your parents. Did you overhear a conversation or an interaction between your parents during that drive?
I did.
What was that about?
My mom was hesitant to get the surgery. She was talking to my dad, saying that maybe we should delay the surgery until this. Well, yeah, a few things. She wanted to maybe push it back until the summertime because I would be home for, almost a 3-month period. And then she also had been recently diagnosed with some mild hypertension and wanted to make sure her blood pressure and things would be under control. And then also she wanted to lose some weight before having the surgery.
And your dad was present?
He was.
He was listening to this?
Yeah.
Did he have a reaction?
Yeah, he had a very strong reaction.
What was that reaction?
He got really angry at my mom and said, "No, you cannot do that. If you don't have the surgery now, you're not getting it." He was raising his voice and very animated, and also said that he had already paid for the anesthesiologist and the operating suite. And then he also said that if we didn't go through with the surgery, Dr. Thompson would be out a lot of money.
Okay. Eventually, did you attend this consultation
I did.
with Dr. Thompson? Okay. Tell us about this consultation. Who was present, and just tell us about what happened.
Myself, my mother and father, and I believe Ada was there as well.
Okay.
Or maybe, I'm not 100% if Ada was there. But during the consultation, the doctor just talks about, different things to expect. He was getting medications ready for her or the prescriptions ready for her so she could have them after her surgery.
Who was that was doing that?
Dr. Thompson was writing the prescriptions.
Okay. Let's talk about that just for a moment. Your father was present during this meeting.
That's correct.
Did you overhear him speaking to the doctor about prescription medications?
Yes.
What happened, and what did your father say?
My father had a list of medications that he had prepared previously that he wanted Dr. Thompson to prescribe.
When you say he prepared that previously, how do you know that?
I'd seen him writing them down a couple days before. I don't know if it was a couple days or the day before, but I had seen him in his room writing medications down that he wanted the doctor to prescribe.
When you observed him writing these medications down, was he referencing anything?
Yeah, he had a physician's desk reference that he was flipping through.
Is that referred to as the PDR?
Yes.
And what is the PDR?
It's a list of pretty much all of the medications out there, their indicated uses, the side effects, the warnings. Kind of when you get when you pick up a prescription, when you get that little paper that comes with it that has a million things written on it.
The insert?
The insert. Basically, it's all of those about all the medications that are out there that are being used.
Is this a big book?
It's very big and thick.
Very thick book. And you mentioned that this was at the house. So there was
Yeah.
a PDR at the house?
Yeah, there was. It was just something that, I mean, I remember because it was surprising because I've not seen him reference a PDR in probably 10, 15 years.
Okay.
And it was dusty as well.
Okay. So your father was referencing that and making a list?
Yes.
Okay. Back to the consultation.
Mm-hmm.
What did your dad say to Dr. Thompson about this?
He said that he wanted just to make sure that my mom had all the medications that she would need, and he wanted him to prescribe certain medications.
Do you recall what those were?
Some of them were like Phenergan, Lortab, Lortab liquid, and, you know, a couple other medicines he had. Also Ambien and Valium.
Okay. Are you aware as to whether or not those prescriptions were written out?
Yeah, Dr. Thompson, I was really embarrassed because my dad was telling the plastic surgeon what medication he wanted. I vividly remember this, and it was.
That embarrassed you because of why? Why did that embarrass you?
Well, he's a plastic surgeon. I mean, he knows what medications are appropriate to prescribe. It wasn't my dad's place to do that, and I just thought it was really strange and embarrassing. And then he had Dr. Thompson. They were all handwritten prescriptions, and when he got the prescriptions, he looked down and saw that Dr. Thompson spelled my mom's name with 2 L's. And so he asked Dr. Thompson to rewrite every single prescription. And it was probably 8 to 10 prescriptions. And I was just really embarrassed that he was having him rewrite it out as well.
Okay. With respect to prescriptions, do you have any knowledge as to whether or not your father had prescribed your family members' prescriptions in the past?
He had.
Okay. But not on this date?
Not on this date.
Okay. Do you have any knowledge as to whether or not your father was a primary care physician for your family? Or
Yeah, I mean, we never went to any other doctor growing up. I don't remember ever going to a doctor. It was always my dad who would.
And so,
Yeah.
so what is a primary care physician, as that phrase is understood?
Primary care physician is someone that takes care of a specific population of patients. With like me, a family medicine doctor, we can do, you know, obstetrics, pediatrics, and, you know, also, you know, just kind of see patients throughout their whole lives. Geriatrics as well. Primary care physician is kind of the first physician you go to if you have an issue.
And that was your father for your family?
Yes.
Okay.
And I know my mom, you know, had been prescribed medications by him in the past.
Okay. Did your mom ultimately have surgery then?
She did.
Let's talk just a little bit about that. You mentioned it was April 3rd,
It was April 3rd.
2007.
That's correct.
Can you describe kind of what happened that day?
The surgery began pretty early in the morning. My father, myself, and my mother, we drove up to Bountiful. It was at the Lakeview Hospital. My dad dropped my mom and myself off, and I stayed with her until she went in to the surgery. He left and said he needed to get back to work.
Okay. And do you recall how long the surgery was?
It was a long surgery, probably like 6 to 8 hours. I was there all day.
Okay. And your father was not? Where
No.
was do you know where your father was?
He said he needed to go back to work.
Okay. Did you have any interaction with Dr. Thompson about the surgery?
I did. He'd come out periodically just to let me know how things were going.
Okay. To your knowledge, was it a successful surgery?
Yeah.
Okay.
Yeah, he said he was happy with how everything went.
Okay. What happened after the surgery that day?
Yeah, she, after the surgery, she went into the recovery room and was in a little bit of pain and groggy, and she wanted to stay the night at the hospital. We'd previously, as an outpatient surgery, thought we'd probably be taking her home, but my mom said she didn't want to drive an hour. Bountiful was about an hour away from Pleasant Grove, didn't want to have to make that drive that night, and wanted to just stay overnight at the hospital.
Okay. Was your father present during this conversation?
Yes,
Okay, so he had returned
he had returned
that day?
to
What-
pick us up.
What happened after that?
Oh, he got upset. He was mad at my mom. He said we need to go home. He didn't want her to stay overnight.
Okay. Was there a collective decision that was ultimately reached?
Yeah, so he called and talked to Dr. Thompson.
Who was that?
Who called? Believe my dad did. I know Dr. Thompson was on speakerphone and I was right there with him.
Okay, do you remember where this was? Was this at the hospital?
It was at the hospital.
Was it,
It may have been in the car in the parking lot. Not 100% sure of exactly where I was,
okay.
but it was at Lakeview Hospital.
And what was the substance of the conversation between your father and Dr. Thompson?
My father was just talking to him about, how my mom wanted to stay overnight. Dr. Thompson said he thought that would be a good idea.
Okay. So did she stay overnight?
She did after I had a conversation with my dad, because he was very reluctant. He didn't want her to stay. And I said, well, what's the big deal? We have good insurance. It's just staying for one night for observation. He was very angry. He wanted her to come home. But then after he talked to Dr. Thompson and Dr. Thompson thought that would be a good idea, he kind of changed his mind.
Okay. Did you stay at the hospital that night?
I did. First I had to. My dad said he needed to get home. He couldn't stay that night with my mom. So I had to drive him down from Bountiful to Pleasant Grove, drop him off, and then I drove back up to Bountiful to be with my mom that night.
Okay. When did Michelle return home to Pleasant Grove after the surgery?
She returned home the next morning.
Okay. And did you drive her home, or?
I did.
Okay. Did you have the vehicle?
Yes.
And having come back up the night before?
Yeah, I had the Suburban.
Okay. What was your role with respect to your mom in the days that followed the surgery?
I was pretty much her caregiver. I'd help her, give her the medications that she needed, help her with her eye ointments. Initially, when she came home, her eyes were bandaged, so she wasn't able to see. So I had to help her, go to the bathroom and do things like that.
Okay. Can you describe these bandages, what they looked like?
Yeah, there was some gauze around her eyes, and then she had an ACE wrap. She also had some gauze around her forehead area, and then believe another ACE wrap around her forehead.
Was she effectively blind?
Yeah, she couldn't see because there was gauze and the ACE wrap.
Okay. She was like that her first day
Yes.
coming home. Do you know how long she continued to have those bandages on her eyes and face?
I'm not 100% sure, but within, 48 hours, she no longer had those bandages on her eyes. She still had the gauze and bandage around her head this way. Oh, sorry.
Okay. But she could see within about 48 hours?
Yes.
Okay. That first day home, do you recall that day? What you were doing with your mom?
Yeah, I mean, I was helping her. I made sure I really wanted to do a good job helping her out. I mean, she was my mom. So, I mean, I was taking her vitals, her blood pressure, pulse, doing things like that, rubbing her legs. And
What was the purpose for rubbing her legs?
well, I wanted to make sure that she would have good circulation. So, you can develop a blood clot if you've been sedentary for quite a while. So wanted to make sure that she didn't get a blood clot.
And what's the
Will
risk of a
you,
blood
I'm
clot?
sorry, will you make a record of her description of the bandages? She made a
Yes, I will.
motion around her head.
Thank you, Your Honor. For the record, the witness described that she pointed to her face, to her eye areas, when she discussed the gauze being on top of the eyes. She then discussed an ACE bandage that was wrapped around her head in sort of a horizontal fashion around the head over the eyes. And correct me if I'm wrong, but I believe she also described an ACE bandage that was wrapped around her chin and came up above her head as well. Is that accurate?
That's correct.
Ms. Summers?
And when the bandage, you testified that she could see after 48 hours. Was there any bandages over her eyes at that time, or was it just the bandage around her head and jaw?
Just the bandage around her head and jaw, I believe. I mean, she did have a few little steri strips, which are just like a little bit of tape around some of the incision areas as well.
Okay. Let's talk just a
Thank
little bit
you.
about the eyes for more clarification.
Mm-hmm.
Why did she have to have bandages on her eyes? Were there incisions on her eyes or right near her eyes?
Yeah, I believe, yes.
Do you
Well,
recall the location of those incisions?
I don't recall 100% the location, but I did have to dress little wounds around her eyes and face area.
Anything in the eyelid area? Or the eyebrow?
Mm-hmm.
Okay. Do you recall having to dress wounds in that area?
Gosh, I believe so. I believe that was where the standard incisions were, but I don't remember 100%.
Okay, okay. Did you continue to care for her throughout that day?
I
The
did.
day after surgery, so we're talking about April 4th.
April 4th,
2007. What about into the night?
No, I wasn't able to care for her at night.
And why not?
Because my father told me I needed to leave. He said that he would be taking care of my mom and that I needed to go and get some sleep.
Okay. You recall about what time of day this was or what time of night?
Not 100% sure, but it was in the night.
It was dark out like?
It was dark out, yeah.
Okay. And what did you do?
Well, first I said that I didn't want to leave my mom. We had it set up in her room where there was a hospital bed, and it was right next to a couch. And I had just planned on sleeping on the couch and being there for her so I could take care of her. And I said, no, Dad, I'm just going to stay here with Mom so I can help her.
Was this in a bedroom?
This was,
Bed?
yes, this was in my parents' bedroom.
Okay. So you had this conversation with your dad,
Mm-hmm.
and you can continue. What happened?
He insisted that I leave. He pretty much forced me out.
Okay. And what did you do then?
I went to my little sister's room. That was, there was a bathroom, and then my sister's room was right next to that on the same floor. I went to her room, and I slept there that night.
Did you sleep soundly that night? To your record?
I don't remember not sleeping soundly, so it was uncomfortable. I was on Ada's little princess bed. That was a double bed, so we were both squished on there. I don't know how comfortable I was, but
Okay. Do you remember waking up the next day?
I do.
And do you recall about what time that was?
Early, probably around 6 in the morning. I'm a early.
So this would have been April 5th now.
Yes.
Okay. And what did you do upon waking up?
I went right into my mom's room.
Okay. And what did you see?
I saw my mom, and she appeared to be very sedated.
And when you say she appeared to be, how did you come to that conclusion?
I went over there and tried to wake her up, and she wasn't waking up.
Did you do anything physically to try and wake her up?
I shook her a little bit.
And how did she respond to that shaking?
She made a few little sounds and moans, but she would not wake up.
Did you say anything to her as you were trying to wake her up? if you recall?
I don't recall. I don't recall, but I'm sure I was saying mom, mom.
Okay.
But, sorry.
What happened next?
I checked her vitals. She was breathing, and her blood pressure was okay. Her pulse was a little low, but okay. And she, yeah, that's about what I did. And then I went to talk with my father.
Okay. Before we go there, you're in your first year of medical school.
That's correct.
You're about to complete the first year.
Mm-hmm.
Did that experience, was that simply classes, or did you do something that was practical in addition to just going to lectures and tests and things?
No, we had physician shadowing opportunities and physical exam classes where we learn the basics of examining patients. And
Okay. Are you able to indicate what your training and experience and education would be at that point in medical school compared to a nurse?
it would probably be pretty comparable at that point. I mean, for learning, the basics. I know there are very specialized nurses as well who have a lot of training and experience, but I knew, the basics.
Okay. So you went to speak with your father. Describe what happened there.
Yeah, I went to my father and I said, what happened? Obviously, Mom is over-medicated.
And did he respond?
He said, yeah, and he did respond, yes. He said, yeah, I think I gave her too much medicine. I must have given her too much medicine.
Did you did you follow up and ask about what medicine?
Yeah, I said, what did you give her?
And do you recall what he said?
He said he gave her Lortab, Valium, Ambien, and then he said that she threw up, and then he gave her some liquid Lortab. I believe he gave her Phenergan and Arnica as well.
Arnica. Do you recall him indicating whether or not he had given her Percocet?
I believe he said he gave her Percocet. I wrote down what he told me he gave her.
Okay, let's talk about that for just a minute.
Mm-hmm.
What was this that you wrote down the medications on?
I wrote it on a green, not a prescription pad, but I think it was like a Zyrtec pad of paper.
And was there a purpose beyond just writing down what your father had told you that morning for this pad of Zyrtec?
Yeah, well, I wanted to make sure that I, like I said, do a good job taking care of my mom. And so I would write down all the medications that I was giving her and what time that I was giving her.
When did you start doing that? Writing down the medications?
I started doing that right away when she'd come home.
When she came home?
Uh-huh.
Okay. Did you continue to write down these medications that were administered to you?
I did.
Okay. Apart from what your dad described as far as what he gave to her,
Mm-hmm.
Did you administer the medications to your mom in the days that followed?
Yes.
Okay.
Well, because I told him, I said, after he said, yeah, I did give her too much medicine, I said, well, you're not to give her any more medicine. I'm taking over.
Okay. And you continue to document this on the Zyrtec pad?
I did.
Was there something that changed? Did you use something else to document what you were doing for your mom
Yeah,
later?
I was using another book as well. It was a little black book that had a gray prescription, or a gray pad of paper on it that was lined. And I was putting her vitals and different things, what she was eating, things like that, in that paper, or in that little black book.
Okay.
Uh-huh.
When did you start using that little black book?
I decided I just wanted to have a more accurate detail of not only what time I gave my mom the medications, but I wanted it to be just in the same book as where her vital signs were and what food I was giving her. So I just kind of wanted to clean up the book a little bit. So I made this other copy of in this black book of the medications that I was giving her and her vitals, what she was eating and drinking.
Okay. Do you recall whether or not your dad told you, he said that he must have over-medicated your mom.
That's what he told me.
And he described the drugs. Did he tell you when he was giving these drugs to your mom?
Yeah, I said, I asked him, I said, what time? And I think he kind of gave me a rough estimate that I wrote down as well.
Do you happen to recall those times?
I believe it was midnight to 1 a.m., something around that time.
Your Honor, may I have permission to approach?
You may.
Just take a look at that document there. And would ask you if that helps refresh your memory as to the times that your dad indicated he gave her the drugs.
No, it does, because I had written it down.
And what times did he give her the drugs that you indicated that were administered?
So he told me that he gave her the arnica at 12 a.m., the Valium at 12 a.m., the Lortab at 1 a.m., the Phenergan at 1:30 a.m., and then gave her 2 Percocets at 1:30 a.m., and then 1 Ambien at 1:30 a.m.
Okay. Thank you. Do you recall how many days that you used the Zyrtec pad before you started using this black book?
I think it was 3 or 4 days, something like that. Not 100% sure.
You may.
I'm handing you some documents here. Would this help refresh your memory as to how long you used the Zyrtec pad? Maybe take a look at that for just a moment. How many days did you use the Zyrtec pad?
4 days.
For 4 days. Does it start with a certain day?
Yeah, it starts with the day that my mom came back home after being discharged.
And did you refer to that as day 2?
Yes.
Okay, so that's
And so that would be day 2,
day 1 would have been the surgery.
day of surgery. Day 2 would be the day after, yes.
Okay. And then you later started using a black book.
Yes, I did.
Did you memorialize the information from the Zyrtec pad into the black book?
Yeah, I transferred everything over.
Okay. Do you recall where you kept this Zyrtec pad?
Yes, I do.
Where were you keeping it?
In my parents' room, by the armoire that they had their TV in, there was a little corner. There was a little plastic set of drawers. On top of the drawers is where all the medications I kept for my mom, as well as the black book. The Zyrtec I'd put in a couple of drawers. There's a few drawers down. I put those in there.
Okay.
That in there.
So ultimately, this was separated from where the black book was?
Yes, because the black book had all the rest of the thing, like the vitals and everything in it as well.
Okay. So that morning, you have this discussion with your father. Did you stay with your mom that day?
I did.
And describe that day, if you will, what you did.
Well, I'd been in there since about 6 in the morning. I still was helping, dress her wounds, and things like that. I was checking her vitals periodically, trying to get her to fully wake up.
Can you kind of describe for the jury her state throughout that day? How she was responding or not responding, things like that?
Yeah, so initially, she really wasn't responding to any questioning or anything like that. I was trying to wake her up, say, are you okay? Are you okay? But then throughout the day, it took a long time before she became alert enough to respond to me. And
Okay. Despite her, at what point did she become, I'll use the term lucid, to actually speak and carry on a conversation with you? At what point would you say?
It was later on in the day. Would have been guessing maybe early evening, where we were having, where we could have like a full conversation.
So there was communication before then?
There was.
What did that amount to?
Well, just, little things, like she'd groan and say, ow, I could tell she was hurting a little bit. She was able to talk a little bit, but not, I didn't have like a full conversation with her until later on in that evening.
Okay.
And I was checking her vital signs throughout that whole day.
Okay. Did you administer medication to her throughout that day? Even though she wasn't lucid and entirely awake?
Yeah, even though she wasn't fully lucid, yeah, I was still at certain times, but it was.
What kinds of medications did you give to her?
I'd have to refresh myself on that book, but I know in the beginning I would still do her little eye ointment and the hydrogen peroxide to clean her incisions, and then I believe in the early afternoon I gave her some maybe arnica, one of the herbal medications. And
Would day 3 of the Zyrtec pad, would that help refresh your memory as to what you did?
that would, because I wrote it down.
Take a look at that for just a moment.
Okay.
Tell us what you were administering to her throughout that day, leading up to that evening.
Okay. So at 9:45 in the morning, I gave her eye ointment. At 10 o'clock, I dressed her incisions. Well, did the hydrogen peroxide, polysporin as well. And then at 12:50, she took a methylprednisone, which is a steroid.
And what is that? It's a steroid?
It's to help inflammation, basically to decrease inflammation.
Is it in pill form?
Yes.
Okay, so by 12:50, so almost.
By 12:50, yeah. She was lucid enough to swallow medications.
So this was approximately almost 7 hours from the time you first observed her in the morning.
Yeah. So it had been, like I said, quite a while.
Okay, what else did you?
At 12:50, I gave her Premarin.
And what's Premarin?
Premarin's an estrogen.
Okay.
My mom had a hysterectomy previously, and so she took estrogen pills.
What about later?
At 2:45, I gave her 1 Percocet.
Okay. Now Percocet, that's a narcotic.
Yes.
Yeah, pain medication.
It's oxycodone and acetaminophen combined, so Tylenol and oxycodone.
Okay. And do you recall the purpose of why you would have given her a Percocet at that time?
Because she would have been in pain, or,
Okay.
saying that she's hurting.
And this was at 2:45 in the afternoon?
At 2:45 in the afternoon, yes.
What happened next?
At 4:00 p.m., she got cephalexin, which is Keflex as well, which is an antibiotic.
Okay.
At 5:15, she got some vitamin C and then another dose of her methylprednisone. And then at 7:15 p.m. at night, she had one Percocet.
Okay.
At 10:30, she had another methylprednisone.
Now, you described she woke up, or you had I mean, she was lucid enough to converse with you sometime later in the evening. Does looking at this day 3 of the Zyrtec pad, does this help clarify maybe about the time you would have?
It does. I mean, I know it was before my dad got home from work. And he usually got home around 6 o'clock.
So you believe she woke up and you talked?
She was back to more of a normal state by then, where I could speak with her and have, a normal conversation.
Okay. And then you continue to administer medications to her and help her out throughout that day after she had woken up?
Yeah, I did.
Okay. Was there another Percocet that you administered to her later in the evening?
At 11:05 p.m., she had one more Percocet.
Okay. You've indicated that she woke up and that you had a conversation. I'll retrieve that now.
Okay.
What was that conversation?
I asked her what happened.
And it's been a few minutes
Yeah,
since we talked about what happened.
yeah.
So you asked her what happened. What is the what happened?
What happened, because she was very sedated and over-medicated when I went in that morning. And she said, Lexi, I don't know why, but your dad kept giving me medication. He kept giving me things, telling me to swallow. And she said I even started to throw up, but then he started giving me more medication and kept giving me medication, talked about how she had to drink even like the Loratab, the elixir that my dad had Dr. Thompson prescribe. But she said that he kept giving her medication.
Okay. Did she say anything to you about, well, let's describe her demeanor as best you can. She still has bandages on her eyes and face.
Yeah.
But
She was upset. She was upset
how could you tell she was upset?
because I knew my mom. I could hear it in her voice.
Did she make any specific requests as far as how the medications would be administered to her?
She said that she didn't want my dad to give her any more medicine, and that she actually had me take out every single pill from the pill bottles, and she wanted to feel what the pills felt like in her fingers, so that if my dad tried to give her anything, she'd know what he was giving her. But she had me take out every single pill, and she felt it in her fingers, and I told her, this is this medicine, because at that time she couldn't see.
Okay. Did that persist for a couple of days until the bandages were off? As far as her
Yeah,
wanting to feel?
Yes. Yeah. But she said she didn't want my dad to give her any more medication. She wanted me to be in charge.
Okay. Let's talk about maybe the rest of that week a little bit, or the days following. Continue to care for your mom?
I did.
In what way?
I still helped give her medications and keep track of her vitals and when her medications were given. I helped her, go to the bathroom, but over the next few days, I mean, she had her bandages coming off, and she was able to get up and walk around and do a lot herself, but I still stayed by her side. I helped her wash her hair and do things like that as well.
Okay. So she's getting up occasionally, and
She was getting up a lot. I mean, not just occasionally. She was getting up all the time.
when would you say that started as far as her getting up?
Probably more when she got the bandages off. So within, I'm guessing, about 48 hours of being home, she didn't like sitting in bed. So she was getting up and moving around.
Okay. Were there any post-operative visits?
There were.
And describe those.
I believe there were 2 post-operative visits. First one, we just went to, Dr. Thompson would just check the incisions and make sure things were looking good and that there wasn't any infection or things like that.
Do you have a memory about how many days after surgery that would have been?
That would have been a couple days after. I mean, she had her eye bandages were off at that point.
Okay. And you mentioned you thought there was at least one other.
Yeah, I know there was one other one.
What was the date on that one?
That was April 10th. It was right before I flew back to Las Vegas.
Okay. So surgery was April 3rd. April 10th was the final post-operative visit. And did you attend those visits with your mom?
I did.
Do you recall who else was present?
My dad was present, I know for sure, at the April 10th appointment because he drove with my mom to drop me off at the airport.
Okay. You mentioned that you were caring for your mom throughout this period, these days. Were you doing other things around the house as well?
You know, cleaning, cooking, taking care of the kids.
Okay. Were you taking them to and from school and ballet?
Yeah, I drop them off at their ballet classes or school and different things like that, yeah.
Okay. So it wouldn't be fair to say you were with your mom constantly 24/7 for
No. Well, and I mean, she really didn't need someone to be with her 24/7. She was healing, and yeah, initially I was with her.
Okay.
A lot
Do you recall
more.
your father, was he present during these days?
Yeah.
Did he stay home from work, or what was his presence in the home in those days?
No, he didn't take any time off of work. He just come home normally at the end of the day.
Okay. Let's talk about this last post-operative visit with Dr. Thompson. You indicated that was April 10th.
It was.
Okay. And describe what went on in this visit. You mentioned that your dad was there.
Yeah, my father was there. My mom was there. She was getting a few, I don't know if they were posts or staples, something Dr. Thompson was taking out of her head where the incisions were.
Okay.
And I remember her being really happy to have those out because she thought they were like little horns, and she was joking with Dr. Thompson saying, good, you took my horns off, just kind of joking around a little bit. My father was there. He'd asked Dr. Thompson if Dr. Thompson thought that my mom was doing well enough that he could take her on a cruise on Sunday.
Your father said that?
Yes.
Okay. You recall what day of the week that was? April 10th?
Well, Wednesday was April 11th, so it would have been a Tuesday.
Okay, so he was referring to a cruise that would begin that next.
Yeah, which surprised me and surprised my mom because he'd never said anything about taking her on a cruise before, but he asked Dr. Thompson, he said that he wanted to take her on a cruise on Sunday so she could have a full 2 weeks to kind of recover and relax.
Okay. Describe your mom's, how was she feeling? What did she look like during this last visit?
She was actually feeling really, really well. I mean, she was joking around, and she still had some bruising under her eyes. The swelling, still had some swelling, but most of the swelling had gone down quite a bit. She had one bandage around her head.
And where was that on her head?
It was just around her head this way.
So horizontally, maybe in the forehead
Yeah, more
area,
of a
around,
coronal type view. Yeah.
and like the brim of a hat.
Yeah, I believe so. Not 100%. I know she had an ace wrap around her head. Either it was that way or this way, but I think it was like
And
the
when
brim
you say
of the
this
hat.
way, it might have been underneath the chin and
Yes.
over the head.
Yeah.
Okay,
I don't think it was under the chin though.
okay. How was she seen at that time?
How sorry.
Was she seen? Was she?
Oh yeah, she was seeing. Yeah, she was. We, right after the appointment, we went out to dinner. She was out and about in public.
Okay, did she seem to be walking fine?
Oh yeah, she had no problem walking.
Okay, so following the visit, you said you went to dinner. Where did you go to dinner?
We went to dinner at Sizzler in Bountiful.
Okay. And do you have a memory as to what you ate or your mom ate?
I know my mom, she'd always get the teriyaki dinner with extra chutney.
Did she have that meal?
Yes, she did.
Okay. And do you recall who was present at the dinner?
Yes, it was my mother, my father, myself, and Ada.
Okay. What did you do after eating at Sizzler? First off, do you recall what time of day that was? That the meal was?
It was, I mean, it was evening. Not 100% sure on the time, but I'm guessing probably around 5 or 6, something like that. It was before my flight, and I
Okay.
think I arrived back in Vegas around 8, so it would be a 1-hour flight. Yeah, so I'm guessing 5 or 6.
Okay. So you then caught a flight after dinner?
Yeah, I was dropped off.
Okay. Who dropped you off?
We just drove directly from Bountiful to the airport. It was my father and my mother and my little sister Ada.
Do you remember who was driving?
My dad was driving.
Okay, so your dad was driving. Prior to being dropped off at the airport, you'd been with your mom for several days. Mm-hmm. Can you describe what medications you were giving as far as the narcotics that were prescribed?
No. She was taking very little. Maybe she was taking 1 or at the most 2 Percocet a day, but
Was she taking them like 1 pill at a time, 2 at a time?
no, I'd normally give her a half, but most of her pain was actually really under control, and she was feeling really well when I left. I wouldn't have left otherwise.
Just for clarification, you mentioned a drug earlier called arnica. What is arnica?
I'm not 100% familiar with it. I know it's an herbal supplement that I believe Dr. Thompson said that he prescribes to all his patients that helps with the bruising process. So
Okay.
that's all I know about arnica. I've never used that.
I'm going to ask you specifically about some drugs. Percocet. Mm-hmm. You mentioned that she was down to 1 to 2 Percocets.
At the most, I'd have to refer to that book. I had everything. I was still writing down what I was giving my mom in that black book,
Black book.
but it was gone.
We're going to get there in a few minutes, but did the black book disappear?
It did.
What day did the black book disappear?
April 11th, 2007.
Okay. To ask you about Valium. Do you recall ever giving your mom Valium during the week, those days that you cared for your mom?
No, I never did. She wasn't having issues with any anxiety.
Okay. You recall ever giving your mother Phenergan?
No.
And do you recall what the prescription for the Phenergan was? What it came in, the form of the?
The Phenergan was a suppository.
And just for the record, a suppository is administered how?
PR, rectally.
Okay. So you never administered Phenergan to your mom?
No.
Okay. What about Ambien? Did you ever administer Ambien to your mom?
No, I didn't. She didn't have any issues with sleeping or having a difficult time sleeping. And the narcotics make you sleepy too. So she never needed the Ambien.
Okay. You did, however, administer Percocet throughout the week.
I did.
She was tapered down significantly.
Yeah, my mom didn't like taking medications, and she was sensitive to medications, so she would always try to take a lot less than what was prescribed to her.
When you say she was sensitive to medications,
I guess I'm talking about narcotics.
okay, sensitive to narcotics.
Uh-huh.
Did you have some experience of being with your mom then when she had pain or she was recovering from pain?
Previously through surgery. Yeah, she'd broken her arm back in 2000 to 2003. I don't know specifically what year, but yeah, I helped her when she was recovering from that as well, and they had prescribed narcotics.
Okay. Did she take many of those narcotics back then?
Mm-mm.
Okay.
No, she didn't like narcotics.
So when you say she was sensitive to drugs, that's based on your personal experience with your mom?
Yes.
Okay.
No, she always had a lot left over.
Okay. So you caught a flight on the evening of April 10th to return home to Henderson, Nevada?
Yes.
Okay. And did you have school beginning shortly thereafter, or?
Yeah, I had classes starting the following morning, the morning of the 11th.
Okay. You arrived in Vegas at the airport?
Yes.
Okay. Did you speak to your mother that evening?
Yes.
At any time?
Mm-hmm.
Okay.
I did. I spoke when I got there because I know she'd want to know if I was safe.
Did you call her?
I did.
Okay. Did you ask her how she was feeling?
Yes.
And how did she respond?
Oh, she said she was feeling fine.
Okay.
She was getting back to, kind of her normal routine.
Okay. The next day is April 11th,
Yes.
and we've already talked a little bit about how you found out your mother had died and you returned home.
Mm-hmm.
I want to talk a little bit about that morning. Did you ever speak to your mom that morning?
Yeah, I did.
Okay. And you recall about what time that was?
Yeah, the last time I spoke to her, it was before 8. I think it's 7, if I looked at my phone records, about 7:45.
Okay. Would that have been Las Vegas time, 7:45?
Yes,
Okay. So 8:45 Utah time.
that's correct.
You talked with your mom. Did you ask her how she was feeling?
Yeah, I did. That's the first thing I asked her.
What
How
did
are you
she say?
doing, Mom? Said she's doing great. She was happy. She was getting up, ready. She was ready for the day.
Did she ever talk to you about her plans for the day?
Yeah, she said she was going to pick up the girls from school, and
Was there a routine?
they had ballet, and they had, they had a very specific routine every day.
Okay. When you talked with her that morning, was her speech slurred in any way?
Oh, not at all. She sounded really, really upbeat and happy. I mean, I could hear it in her voice.
Did she seem confused in any way in the
Not-
language or the type of voice she used?
Not at all.
Okay. You remember where you were when you had this conversation with her?
Yeah, I was in my apartment in Henderson.
Okay. And what were your plans for that day? Where did you go after that?
I went to school. I had an 8 o'clock lecture.
Okay. Did you ever receive any other phone calls? Did you receive a phone call from your father that morning?
I did.
Okay.
And I missed the call because I was in my lecture. I had my phone on silent. But during the break, the lectures were usually 50 minutes long. And then during the 10-minute break, I looked down. I saw that I'd missed a call from my dad, and there was a voice message.
And what was the voice message?
The voice message was my dad saying, "Alexis, you need to call your mom. You need to call her right away. She's not listening to me. She's getting up. She's out of bed. You need to call her and tell her she needs to rest."
Okay. How did you react to that?
I thought it was strange. Thought it was actually really strange because my mom, I just talked to her. She was doing well. I'd just been with her, the day before, and she wasn't in bed or bedbound. I mean, she was back to kind of her normal self.
Okay. You mentioned that you had talked to your mom about 8:45. That would be Utah time.
That would be Utah time, yeah.
Do you recall what time you received the message for the voicemail from your father, approximately?
Las Vegas time, it was about 8:10, 8:15.
Okay. So about 9:15 Utah time.
That's correct.
Okay. In response to receiving that call from your dad, that voicemail, what did you do?
I called home, called my mom.
Okay. And did you get a response?
No one answered.
You remember about what time that would have been? You mentioned there was a delay between the time you received the message but
Yeah.
listened to it.
So it would have been during my break, probably around 9 o'clock Vegas time, which would be 10 o'clock Utah time.
Okay, so you called home and didn't get a response?
No, I didn't.
Okay, what did you do after that?
Well, I had another lecture starting up, so I went back in and sat for my lecture.
Okay, and did you finish that lecture?
I did.
What did you do after that lecture?
I called home.
Okay, and was there a response?
Yeah, my father picked up the phone.
And what did he say?
He said that your mother's not breathing. She's in the bathtub. I've called an ambulance, and then he hung up.
Okay, and we referred earlier to this conversation in this examination today, correct?
Yes, we did.
Okay. You talked about grabbing a flight and coming home. And that you did return home to the home in Pleasant Grove. Did you go straight from the airport to the home?
I did.
Okay. When you arrived home, what happened?
I walked in the door. I saw my brother and Eileen were in the living room. I gave Damien a hug, and then I went straight back into my parents' room.
Okay. And what did you see in your parents' room?
Well, I went back there because I wanted to find the medication. That was the reason I went back there. But I saw that the room had been cleaned out.
Meaning what?
Well, just the night before. I mean, the hospital bed was there, and the hospital bed now was gone. Like little stuffed animals and blankets and things that were around the room were gone. All of the things that were there that night before
Okay.
had been removed.
You mentioned you went looking for the medications. What did you find or not find?
I didn't find the medications.
Where did you look specifically?
I looked right where I'd left them, right on that little cabinet of drawers. There was nothing. There wasn't no medication, and that black book wasn't there as well.
So the black book was gone.
Oh, yes.
You describe again where the black book was kept?
Yeah, just right. I mean, I put it, put pretty much the medications like right on top of it as well. So it was just a small little drawer that the medications were sitting on the top of this little chest of drawers, and then the black book was there with it as well.
Okay. Just a moment, Your Honor. Alexis, I'm handing you what's been marked as State's Exhibit number 47. You've referred to this, but can you describe what that is?
Yeah, this is the Zyrtec pad where I initially was writing all of my mother's medications on, following her facelift.
And you've used that to refresh your memory today?
I
as to Some
have.
specifics?
Yes.
Okay. Where was that kept in relationship to the black book again?
Since I had transferred everything to the black book, just shoved this in one of the drawers underneath.
Okay. Was that missing when you went looking for the drugs in the black book?
No, this was there.
So that survived. Your Honor, the state offers Exhibit 47. States.
Any objection to 47?
No objection.
State's Exhibit 47 is received.
Retrieve that.
Okay.
This exhibit shows day 2, and then it shows a day 3. And that lists the times of 12 a.m., 12 a.m., 1 a.m., 1:30 a.m., 1:30 a.m., and 1:30 a.m. and lists drugs next to that.
That's,
Can you clarify for the jury, and then then it jumps to 9:45 a.m. Can you clarify what those first 6 times in drugs are in relationship to the others that are listed?
those are the medications that my dad gave my mom
So
the night before I found her very sedated.
So the Arnica, Valium, Lortab, 3TI, what does that
I think 3 tablespoons, because I think that was the liquid Lortab.
The Phenergan, Percocet, and Ambien.
That's correct.
Okay. You didn't find the drugs. Did you look elsewhere for the drugs?
I did, but
Where
first
Oh, go ahead.
the first thing I did was look for the medication, and then I asked my dad, "Where is the medicine?"
And what did he say?
He said, "I don't know. I think the police might have taken it."
Okay.
And then,
And what did you do after that?
well, right after that,
Sure. Or did you look for the medications anywhere else?
I did. Not specifically at that time. First, I asked my dad how he found my mom.
Okay.
But,
Let's talk about the medication,
Okay,
and then we'll come back
okay.
to that.
so yeah, I went looking around the house. We kept medication in the kitchen as well. There was like a little medicine drawer we had. Didn't see it there. Went into the garage because I believe my dad had said that they'd taken a bunch of my mom's things out there.
Okay, what did you find in the garage? Did you find the medications in the garage?
No, I didn't find the medications anywhere.
Okay. Did you find anything else in the garage?
I did.
What did you find there?
I found a pile of wet towels and
Okay.
some clothes.
Okay.
It was also found a rug from the bathroom that was out there as well. And then there was a blue, like a Rubbermaid gallon bucket or 5-gallon bucket that had some of the things that had been in my mom's room.
Like what?
There was a humidifier there. There was the blood pressure cuff, a few other things like that.
Okay. You mentioned that you went to after not finding the drugs, well, after speaking to your dad about what happened to the drugs, he wanted to show you something?
Yeah.
Okay, let's
Well-
talk about that.
After I spoke with, asked him about where the medication was, I said, "What happened? How
Okay.
did you find Mom?"
And what did he do?
He took me into the bathroom and showed me how he found my mom.
Okay. I'm going to ask you if you would just come down into the well here. And I first want to orient you to an exhibit that we're using for demonstrative purposes. This bathtub, this red sticker here indicates the approximate location of where the faucet would have been on this tub. Does this appear to be an accurate reflection of the tub that was in your parents' home that your dad was referring to when he wanted to show you how he found your mother? Are you able to demonstrate to the jury, well, first describe what your dad said and demonstrate what he did, if anything?
I'm sorry, I don't know if we're picking her up on the record. Are you going to ask her to describe what he said first?
Yes, we'll do that first.
Could I ask you just to come back so that we get that on the record?
Thank you, Judge. I'll just make a record. I was orienting the witness to the demonstrative exhibit, which has been referred to as the tub here for trial purposes. Does this tub, this exhibit, appear to be an accurate representation of the tub that was in the family home on April 11th, 2007?
Yeah, it is.
Is this the tub that your father used when speaking to you about how he found your mother?
Yes.
Okay. Would you describe what he said in describing what he found?
Yeah. He said that he found her slumped over the tub, her head down into the water, and her feet sticking out towards the back.
Okay. Did he describe where her head would have been in relationship to the faucet?
Been down by the faucet. That's what. But yeah, slumped over, face down,
Okay.
covered with water. Her face was in the water.
Face was in the water.
Yeah.
I have just a moment, Your Honor.
You may.
Does this exhibit here, this is not the actual tub, is that your
No, it's just
understanding?
the use of the representation of
Okay,
the
so it's
same
represent-
dimensions in the
Okay,
tub.
so it's a replica of it, same dimensions.
Yeah, to what I remember, yeah.
Okay. I'm going to have you come down now into the well, to the exhibit. Well, first off, so, did your dad actually physically demonstrate for you how he found your mother?
Yeah, he did. He was
So
his arms and head and put himself into the tub.
Okay, let me have you come down and let's demonstrate this to the jury, and then I'll make a record as to what you're physically doing.
Came to the side of it. There was a little step as well, and just put his hands and his head into the tub.
Did he, so the witness is bending down towards the foot of the tub on the edge that's exposed to the tile, to the room, and she's leaning down into the tub.
Yeah, he got pretty far into the tub when you showed him.
And she's describing that the defendant got pretty far into the tub in describing this. Did he tell you where his feet, or where, excuse me, Michelle's feet were in relationship to her?
He just said they were kind of just sticking out the back.
So the feet were sticking out the back towards the foot of the tub. Was he actually slumped over, or was he, did he just?
He was slumped over, and that's how he said found her, that her feet were kind of facing to the back of where the wall was.
Okay.
Kind of pointing to that side, so it wasn't slumped over and her feet this way. It was this way.
Okay, thank you. And I'll make a little bit more of a record. So when you demonstrate that, you're sort of slumped over into the tub, but your feet are still on the floor.
Mm-hmm.
When your father was demonstrating that, was his feet still on the floor when he was demonstrating
Yes,
it?
his feet were still on
Okay,
the floor.
but he described her feet actually sticking up out
Mm-hmm.
towards the back of the tub,
Yeah,
being the foot of the tub opposite from the faucet.
that's correct.
Okay. Did you ever ask him, or did he ever say anything to you about what he thought had happened to your mom?
Yeah, he said she may have slipped and fallen into the tub. And then he also said that she may have had a PE.
PE is what?
It's a pulmonary embolism.
Okay. You referred earlier to a blood clot. What does a blood clot have in relationship to a pulmonary embolism, if anything?
So a lot of times that's where the clot develops, is in your lower extremities, your legs. If you get a blood clot there, it can travel up your vasculature into your heart and lungs, and can cause severe problems, and death.
Okay. Did he ever say anything to her about maybe she was using the bathroom and something happened?
I don't. Well, he thought that she was probably getting ready for a bath and slipped and fell or had a pulmonary embolism, but he didn't say, I don't believe, anything else specifically.
Did he ever describe to you what your mom was wearing when he found her?
Yeah, he said that she had garments on, and a bra, and a top, and she didn't have any pants on or garment bottoms.
Okay.
She was naked from the waist down.
Okay. When you went to the bathroom that day, April 11, 2007, and your dad's demonstrating this for you and describing, did you take a moment to look around the bathroom to see how was anything in disarray or anything like that?
No, I noticed that the rug was missing, and I later found that out in the garage, the little bath rug, but
Now this rug, where was this rug in relationship to the tub?
it was just right below the little step going into the tub, so just so you could step out and step onto a rug and wouldn't slip.
So just to the side of the tub then?
Just in, yeah.
On the outside?
Just in the outside of it, yeah.
Okay. Did you look around the master bedroom at all and notice anything? You
I
noticed?
did. I looked around looking for the medication. Wasn't there.
Okay. Did you, by chance, ever look for garment bottoms or pants or anything like that? That you recall?
I
if you
don't
did.
recall.
Okay. I'm referring you to State's Exhibit number 18. Do you recognize that?
I do.
And what is that?
That's a picture of Gypsy Jillian Willis.
Okay. And at some point, did you come to know Gypsy Willis?
Yes.
And did she go by the name of Gypsy?
She went by Jillian.
Okay. Do you recall the first time you ever met Gypsy Willis?
I do.
And approximately when was that? And where was it?
It was in my home. This was right after I'd finished my finals, my first year finals, and I was driving home for the summer. And Gypsy was there at my house.
Okay.
I'm sorry, it was at your house in Nevada?
No, sorry, at my house in Pleasant Grove.
Okay.
Sorry,
Thank you.
my the family home.
The f-
That was home to me.
Okay. Family home.
Yeah.
In what capacity was she when you met her? I mean, did she have a role in the family?
Yeah. Well, my dad said she was the nanny.
Okay. Did you have any knowledge of a woman named Gypsy preceding your mother's death
I did.
that caused you concern?
I did.
Okay. Let's talk about that for just a little bit.
Okay.
Do you recall a conversation or an argument that you overheard between your parents, the defendant and Michelle, prior to her death?
I do.
Did the topic of Gypsy come up?
Yes.
Approximately when was this in relationship to your mom's death?
So just a couple days before she died.
Okay. And do you remember where this was?
Yes. My parents were in their bedroom arguing at the Pleasant Grove home,
And where were you?
just outside of the door.
Was the door shut, their door shut?
Yes.
Okay. And what did you overhear?
Well, my mom was wanting my dad's phone records.
Okay.
I guess we'll go into that a little bit later, but she wanted the phone records so she could see if he was still calling the number that belonged to Gypsy Jillian Willis.
Did you hear her confront, was the defendant confronted with the suspicions of an affair?
Yes.
Okay.
Yeah. My mom had confronted him previously, but she confronted him again at that time and said, I don't believe your story. I want the phone records. I'm not going to let this die. That's what she said.
And this was in reference to Gypsy?
To Gypsy, yes.
Did she use the name Gypsy?
Yes.
Okay. Did you hear your dad's response?
He told her that she was crazy. He said that it's ridiculous. He's not having an affair. He said that she couldn't get his phone records. Well, he had changed. So she went on to log in to get his phone records. She had his password so she could access his phone records online. She went in that day again to access the new month's phone records and found that he had changed his password. So she confronted him with that, wanted his new password.
And what did he say?
He said that he couldn't give her the new password because his phone was owned by Utah State because he was the medical director at the developmental center, and said that that would be a violation. He couldn't have her look at the records because I don't know if he used the word HIPAA violation or what, but he said that since it was a state record, she's not allowed to see it.
Okay. Now, you mentioned that that she had confronted him before about her suspicions of an affair,
Yes.
and with respect to a woman named Gypsy.
Mm-hmm.
How did you become aware of the name Gypsy? And when did you become aware of that?
It was late March. My mom had confided in me that she was concerned that my dad was having an affair. And so her request, took his phone and was able to get his password for his phone records. I logged in, we saw them online, and we saw that he had been calling a specific number.
Did you check on that specific number?
I did. I called it, I think, 2 or 3 times.
Was this in the latter part of March?
Yeah, I think it was March 20th, around March 20th.
Okay. Let me stop you for just a minute. Where were you at this time you were doing this? As far as physically, where were you at?
I was back in Las Vegas.
Okay. So you're not in Utah, you're in school at this time,
Yes.
communicating back and forth with your mom.
Uh-huh.
Okay.
Well, initially when I got the phone number, when I got into his password, I was in Utah, and then I had gone back to Vegas. And at the time when I was calling, I was back in Henderson.
Okay. Did you come home frequently?
I came home all the time. I mean, that was part of the reason I picked this school, because it was so close to home. I
Okay.
came back all the time.
Like on the weekends and things like
Yeah, I just drive up.
that? And during that process of checking on this phone number, you became aware that it belonged to a gypsy?
Well, yeah, so first we saw this number that my dad had called, really late at night, and so we wanted to, my mom wanted me to call to see if it was a female voice that answered. And
And was it when you called?
it was.
Okay.
And then, so after that, I told my mom, yeah, it's a female. And so she had me, go on to online. It's called Intellus. It's a place where you can put a phone number in and pay, I think it was like $60 or $70 to figure out whose name was associated with that phone number.
Did you register for that?
Yes.
You pay the fee?
Yeah. Mm-hmm.
And what was the result?
Gypsy Jillian Willis.
Okay. And you communicated that to your mom?
Yes.
And approximately when would that have been?
That's
About March 20th?
March 20th. It would have been as soon as I got that confirmation that it was a female voice, I did that immediately,
Okay.
that Intellus search.
Did you ever see Gypsy Willis in the home functioning as a nanny or in her role as a nanny?
No, I mean, I really never saw her do what I would consider nanny.
What did you see?
I saw her, just come and go throughout the day. I never saw her pick up the children or do any cooking or cleaning. I saw her following my dad around a lot. I saw them leaving together often. I don't believe I ever saw her cook at all, I don't think.
Okay.
But she kind of just was there.
When were you first made aware of Gypsy being the nanny for the family?
This was shortly after my mother's funeral, probably within a week after her funeral, when I was back down in Henderson.
How did you become aware of it?
My dad called me on the phone and said, "Alexis, I've found the perfect nanny."
Did you ask what her name was, or did he tell you her name?
Yeah, I said, "Well, Dad, what's her name?" And he started to say, he said, "Jillian." I said, "Dad, Gypsy Jillian Willis. I know that woman. I know Mom was worried you were having an affair with her, and you're not to bring her into this home."
And how did he respond?
Oh, he got irate. He was screaming at me, saying, "How dare you? How dare you accuse me?" And hung up on me.
Okay.
He didn't know that I knew.
Shortly after your mother's death, are you aware of whether or not your father talked with the medical examiner?
Yeah. Yeah,
And the medical examiner is the person that performs an autopsy on the deceased?
yes.
Okay.
It was Dr. Maureen Fricky.
Okay. How is it that you know that your father spoke with Dr. Fricky?
Because he had her on speakerphone when I was there in the room.
And when would this have been in relationship to your mom's death?
It would have been the day after her death.
Okay. And you were present in the room with him?
I know he talked to her on a couple occasions.
A couple of occasions? Okay. It was on speakerphone, you say?
Yes.
You could overhear Dr. Fricky? What was your dad telling the medical examiner?
He was just kind of telling her what had happened that day, you know, how he found my mom.
Did he describe?
Yeah, sorry.
Did he describe how the position of your mom's body when he found her?
He did.
And was that consistent with what you've testified today as to what your dad demonstrated to you?
Yes.
Okay. What else did
He also was talking to her about the medications that she had been taking. He did ask her if she found anything abnormal. And she said, yeah, she didn't have a uterus, and they both laughed.
Do you recall if he ever offered an opinion as to what he thought happened to your mom,
To her specifically,
to Dr. Fricky?
you know, I don't recall right off the top of my head.
Okay. You remember, was anyone else present for this conversation on the day after your mom's death?
You know, I think Rachel may have been in there during certain points in the conversation. I'm not 100% sure.
Okay.
I know she didn't want to hear any details.
Rachel didn't want to hear any details?
She didn't want to hear about my mom's autopsy.
Okay. Are you familiar with your mother's bathing habits?
Yes,
And how so? How would you be familiar with those?
because that was my mom's favorite thing to do, was to take a bath. It's kind of the way that she'd relax too.
You know how often she would take a bath?
Several times a week.
Okay. And was this throughout her life, growing up with her? Mm-hmm. She liked this?
Yeah.
Okay. Are you aware of whether or not she had a specific habit as far as how she would take a bath and the process of drawing a bath and so forth?
Yeah. Yeah, I know. I knew exactly. I'd seen it so many times.
And what was that?
Well, she'd start the bath water up, and then she'd get in it and turn it up as hot as it could go. She liked it really, really hot.
Okay. And then once it was full, she would turn off the water?
Yes.
Okay. Do you know if she ever drew a bath and filled the bath up first and then got in?
Objection, Your Honor, calls for speculation.
Sustained, you may inquire about her routine habit.
Okay. How often did you see your mother bathe? Or the process of
Probably
how she
hundreds of
would-
times. When I was little, I used to sit up there too and put my feet in.
Okay.
So, I saw her.
Did you see her prepare a bath?
Oh, yeah.
In
Hundreds of
addition to
times.
just- Okay. And you mentioned hundreds of times?
Throughout my life, yeah, definitely.
Throughout your life you did. Did she consistently draw a bath in the same way
Yes.
as you've described? She would turn the water on and then get in? Mm-hmm. And then turn the water off after she's already been in?
That's correct.
Did at any point you ever see her turn the water on, fill the bath, and then get in?
Mm-mm.
Okay.
I don't recall ever seeing her do that.
Okay. Alexis, I haven't asked you about your relationship with your mom. Can you describe your relationship with your mom?
Yeah. My mom was my best friend. She was someone that I was always around her. She was kind of like my superhero when I was tried to be her sidekick, you know. She was someone that I just, I adored. She confided in me a lot, and I did the same with her. She was my mom, you know.
Your Honor, I will, just one moment. With respect to the conversation you overheard with Dr. Fricke, the medical examiner, were you curious? Did you want to be there?
I wanted to know what happened.
Okay. With respect to, your father demonstrated and described how he found your mom in the tub that morning, April 11th, 2007. Did he make any statements to you about the water being on or off when he walked into the room?
I don't specifically recall.
I can have just a moment, Your Honor.
You may.
Did you have occasion to email investigators in this case information about the investigation?
Yes, throughout the years, I've definitely emailed them.
If I were to show you an email that talked about the issue at hand, do you think that may help refresh your memory?
The issue
As to what your father may have told you?
Yeah.
You may.
Handing you this document, I'm just going to ask you to read for a moment the final paragraph on the second page of this document. Just read that to yourself.
Okay.
Is that language from an email that you sent to an investigator in this case?
Yeah, that is.
Is there a date on that email?
8/7/2008.
So in 2008. Is it fair to say your memory would be more accurate back then?
Yeah, definitely.
Does that help refresh your memory as to whether or not your father discussed water?
So when he found,
Bathtub?
yes,
What did he say?
he told me that when he found my mother, the water was off and the tub was full.
Okay, so the water was no longer running.
Yeah.
Looking at this, have you ever bathed in your parents' tub where your mom was found deceased?
Yes, before she died, yes.
You haven't bathed in that tub since her death?
It took a long time for me to take a bath.
Okay. Are you familiar with what this is on the tub right here? And I'm pointing to the faucet end up towards the lip.
That'd be where the water would drain if it was overfilling.
So this is an overflow drain.
Okay, is that the name of it? Okay.
Is that consistent with what you?
That's what I would think it would be.
Okay. Taking you back to the final post-operative visit with Dr. Thompson, you mentioned that you were there along with your mom and dad, of course Dr. Thompson, and then Ada was there, you think also. Are you aware of any additional prescriptions that were filled on that day or that were requested by anyone?
On that final day, I'm not 100% aware of. I don't remember.
Okay. Did you ever have a conversation with your dad about your mom's upcoming plastic surgery, the reason she was having the surgery?
I did. Well, when I talked to him about it, just initially,
Initially, yes.
yeah, he said he was giving it to her as a present. He'd surprised her with plastic surgery
Okay.
as a present.
Your Honor, counsel and I have a stipulation with respect to the foundation and to admit State's Exhibit 48. These are some cell phone records from Alexis MacNeill, at the time Alexis MacNeill, now Alexis Summers, and Michelle MacNeill. State offers 48.
Any objection to 48?
No objection.
48 is received.
I'm just going to place it here for now, Your Honor.
Very good.
I'm just going to ask you about some phone numbers. Do you happen to recall your cell phone number at that time?
No, I don't remember what it was.
If I can approach Your Honor. Handing you a handwritten document that looks like you created. I'm just going to ask you a few questions. Would that help refresh your memory as to your phone number and your
Yes.
father's phone number and your mom's phone number?
Yeah, it has them all listed.
What was your cell phone number at this time, the relevant time of this case?
801.
And what about your father's cell phone number?
And 801,
Is it an 801 prefix on your phone as well?
Yes.
Okay.
I'm sorry, it was 70. Thank you.
So I have 801-319. The family home in Pleasant Grove.
801-785-7588.
Your father's work phone, direct line? When you would receive a call from your dad, and so it would show up on your phone, would it show up as a different number than his direct line
Yeah, if he was ever calling from work,
if he was calling from work? How would that show up on the phone?
it would show up as 801.
And then lastly, you mentioned that you had called Gypsy Willis's phone
Yes.
a couple of times in March. And what was the phone number that you would have called?
801.
Thank you. I'll retrieve that.
Okay.
With that, Your Honor, the state would tender the witness.
How long do you think you would be on cross?
Probably a little more than an hour.
Okay. Why don't we break for lunch then? Ladies and gentlemen, please keep in mind my prior admonition to you. You're not to form or express any opinion about the case until it's finally submitted to you for deliberation. Don't do any research on your own using a computer or something else. Avoid television, internet, and other news coverage of the trial. And it's your duty not to discuss any subject of the trial with each other or with anyone else that you might see during the lunch hour. We will reconvene at 1 o'clock. Court's in recess.
All rise.